Hello, everybody. This is Dr. Kashif Abdullah. It is April 17th, 2020. We're starting a little bit later than normal. Sorry for being late. I was actually dealing with patients. I was doing the teleconference. It's been a busy day with me regarding patients, and they're still calling. So, again, if you have any questions, feel free to ask them here. Last time we had a sort of a lively debate, a little bit, but let's see how it started. Hello there, and I was thinking we'll just go over the same kind of things. What's the current questions, and also there's I'll speak about the government is thinking of opening up Corona. Let's see. Also speak about the government possibly opening up possibly opening up states. Okay, so let's see now. Let's change screens quickly and go to, there it is. All right, so if you see here, there is now unfortunately 2,214,000 some odd cases in the world. We've only we've tested in the U.S. alone about 3 million, which is a drop in the bucket. But let's see the daily number of increases. We are there's been a spike up in the last one with 96,000. This was taken yesterday. So of the ones reported on the Johns Hopkins website, there's been a slight bump. If we look at the U.S., they are now 683,000 cases. And there is, if you look at their daily increases, they're basically still up. They're not going down. And I have heard through various news outlets that the president of this country is thinking of opening up this various states by May 1st, which I think is insane. I don't think you should open up any state by May 1st, because that's nuts. To do so would be to basically create the second wave. If you want to create an economic stimulus like this, that's suicide. People will be even more scared. This will cause more deaths. This is insane to open right now, especially in the U.S. If we look at Spain, even Spain has had a market increase in the last day. They were falling, and then all of a sudden they had a giant spike yesterday at 7,000 more cases, and 2 days ago they were only at 2,000 more cases. So there was a big spike in Spain. Let's see if there's any questions. Oh, hello. Someone is saying hello. Hi, welcome, son. Okay. All right. There we go. I'm just responding there. Oh, there we go. Anyway, let's see. If we look at Italy, we are still seeing a trend down, but there was a tiny spike yesterday as well for Italy. But they're trending down. France is, I don't know, really. I don't know. France is weird. It's still, I would say it's just there. I don't know what this is. It's not going up and down, and there's a lot of, this one at 26,000. I don't know how they're reporting in France. I don't think they're sometimes appropriately reporting in France. I'm not sure what they're doing, frankly, there. Let's see. Oh, I've got okay, yes, I need to speak. Someone is calling me. Anyway, Germany there is a spike as well. They're trending down, but there was a spike yesterday. The United Kingdom, they're plateauing, not really falling, but that's not so bad. China is, who knows. And Iran, there was no spike up, but again, I think this is sort of manufactured, some of these numbers. They're just two stepwise down. Turkey is not increasing significantly anymore, but more plateauing. We'll see. We have yet to hit their spike, their peak. Belgium also had a spike recently and sort of a fall, but not too bad. Brazil still trending up. Canada also, just like every other nation in the Western Hemisphere or in Western Europe, has gone up. Canada also had a big spike as well for some reason. Russia is just going on fire, just really high. Let's see if there's anyone asking a question. No one's asking a question yet. Okay. The Netherlands are still going up. Not up, but flat. Not really trending down too much. Switzerland is still going down, trending down. So there was a little bit of a spike yesterday and the day before, but not too bad. Portugal, it's trending sort of down. That's pretty good. Austria is completely going down. So Austria didn't do a spike at all. So Austria looks really nice. The Austrians are doing really well. And Ireland is, hopefully plateauing. India, they're going up. They're just going up exponentially, it looks like. Well, not exponentially, but they're going up. Sweden's plateauing. It looks like Israel maybe trend. It likely looks like it's trending down. There was some talk yesterday about Philippines. Let's talk to the Philippines. I remember there was a lot of interest there. So they were asking, what is my general consensus? I was saying before those two values, it looks like it's generally trending up, but now there's sort of a trend down. So I need more data to telling you which the trend is going. It looks like it's going up and down. So maybe it's plateauing. Maybe we'll see. And then Singapore, that's just exponentially rising. So I would say this: if the world is thinking let's reopen the countries or various parts of the country, I think that's a bad idea, frankly. I think easing restrictions, social distancing, if your leaders are saying this, I think they're premature. I understand the economic value it's hitting everybody. It's hitting me, it's everybody. And but at the same time, our life is worth more than money, right? So it's, I don't know, it's just, we have to keep going. So let's see what the US is doing. So the US is, there's now 662,000 cases, and still the top number one is in New York with a number of deaths, and it's just affecting the entire eastern seaboard, so we're still dealing with that a lot. Let's see if there's any questions anyone was asking. Okay, no. And let's see. Oh, somebody has a question. Is 6 foot distancing realistic, or should we be taking even more precautions? I would say 6 foot is it's okay. I'll say this much: if you go out and you go buy food, right, it's difficult to maintain even that 6 foot. Is it real? Even more precautions? I would say yeah, you should. And the U.S. and the World Health Organization and other countries are saying that, and they're saying that you should maybe try to, well, again, social distancing. Don't go outside as much as you can. And let's see. I am a psychiatrist working in a psych hospital. I wear N95. Is face shield necessary for asymptomatic patients and not acute, in a not acute medical setting? Well, I'm glad you're wearing. So when you're asking the 6 foot distancing, especially if you're a psychiatric hospital and you're near a lot of patients, I would say you should wear an N95 mask. And I should preface the difference between the two different kind of masks. So the hospital mask, the regular surgical mask that people wear, that's only good for preventing you from coughing your stuff out to the world. Okay, that is technically not good enough, to prevent virions, if they're in the air sufficiently, to go through the mask. So technically speaking, the surgical mask is not good enough to protect you. It's good to protect the general public from you spreading your stuff everywhere. It'll prevent that. So I can tell you, in surgery, I have been in cardiac surgery as a medical student, and I've been in pediatric cardiac surgery, where we're literally, the baby is their heart is tiny, and you're working on such a tiny little heart. And the surgeon, the cardiac thoracic surgeon, me, and the nurses, we've all sneezed in vicinity of an open chest. And those surgical masks prevent any kind of nasty stuff going out. Even if we turn our head or whatever, you don't want to cloud. But those things prevent stuff from coming out. The N95 masks are good for preventing stuff from getting in. It's not 100% perfect, and again, it's better than nothing. And this mask is better than nothing. But is a face shield necessary? Well, then, I think that's a little bit extreme. But you know what? Maybe your hospital is just very, very concerned. Maybe they just don't want also a liability. Maybe there is a legal parameter that they're trying to avoid. I think the face shield in general, when we're doing, like, if I'm doing a procedure or something, and I have the risk of some fluid flying in my face, I'm cutting into somebody, or I'm removing something, and there's a risk of splatter, I need a face shield. In surgery, you need a face shield as well. But in general, just walking around, I have not seen those recommendations. But I would imagine, I think the idea is they want to prevent any kind of water droplets of getting in your eyes. And is it necessary for asymptomatic patients? I think that's a little bit too much, but you never know. There might be just abundance of caution. I think your hospital is just doing an abundance of caution. I know it may feel horrible, and you've got like, oh God, I'm gonna wear this thing, and it feels nasty, and I want to scratch yourself. But I think they're just doing it out of abundance of caution. Is it necessary? I don't know if it's necessary or not. I don't think so, but at the same time, why not? Better safe than sorry, especially in a hospital setting, because you don't know who has got what. And I know they're asymptomatic, but the issue with the COVID-19 is it has a possible 14-day window of spread, and that's a long time. So they may be asymptomatic, but they may be spreading. So let's see. Is a 14-day quarantine for out-of-state visitors realistic, or could course of these no, I think so far what we've seen thus far is 14-day is fairly realistic. Is it longer? We haven't found out yet, or I have not seen studies that, so I don't have enough data to say is it. I think it is realistic. I don't think it's longer, and I think it is a 14-day. It could be longer than 14 days, but likely not. There was someone who showed me a study that showed 95% of the cases in a study, not in the population, in a study, showed that within 5 days, 95% of cases are shown. And it showed then with a 99.5% confidence interval that in that study that was enough. I don't need to. I'll have to answer this patient later. That in 95%, the 99.5% in that study had it within 11 days. So 14 days is just that much more extra. I think it is realistic. Realistic could the course. I don't think it's much longer per se. So, thank you for that question, KisssyTube1. And if you have any questions, can keep asking. Let's see. I just wanted to go over if people wanted to about herbal supplements. I'm just going to go over this really quickly. If you have any questions, I'll go back and forth. Let's see. So some people can use garlic. There's a whole bunch of herbal supplements out there: garlic, saw palmetto, ginkgo, echinacea, American ginseng, black cohosh, milk thistle, St. John's wort, green tea, and valerian. So if we're going to go up to garlic, the idea is garlic can help reduce blood pressure, fibrosis, but it can also prolong bleeding. And there's complaints of body odors. And it can actually also interact with some prescription medicines. So I would say garlic as a food is good, and also as a supplement. I would not use it as a blood pressure medicine. That's pretty crazy. But or as like a warfarin to prevent clots, or aspirin. That's not its point. It's there as it's a good thing to eat, and it may prevent it in the long run. Not prevent it, but it would help. I think it's a good thing to take, but don't use it to actively treat any medical disease. Let's see if there's any live streaming questions. No questions thus far. And then saw palmetto. That's used for usually to shrink the prostate, but these are anecdotal evidence, and it's not necessary. I would not again use this to reduce your prostate. Let your doctor give you the appropriate medicines to reduce your prostate if you have like difficulty in urination or your urine stream is not strong in a man. Come to us. Don't just take saw palmetto thinking I'm helping my prostate. Yeah. Ginkgo biloba is used for may protect against memory loss and dementia, but and may improve blood flow through the brain. But this is not a treatment for Alzheimer's. I can tell you. I deal with Alzheimer patients as a hospice medical director all the time. We are not giving anyone ginkgo biloba, and we are not. You want, you can take it. I don't think it's going to help you per se. If it helps, it helps, but I doubt it. It's not an active treatment. So let's see. Any questions? Oh, you're welcome. Thank you again for the questions. And then echinacea, that maybe some people are using right now, made to treat and prevent the common cold and upper respiratory tract infections. Studies are very mixed on this. It's not going to. If you want, you can take it. If it helps, it helps, but I doubt it. This is not something that's gonna be like, don't go out rushing. I need to buy all the echinacea in the world to prevent COVID-19. No, that's craziness. You can take it, and if it prevents something, maybe, but doubtful. Milk thistle is for hepatitis and cirrhosis. So unless you have any kind of hepatitis issue, I think milk thistle is not necessary. St. John's wort is some people use for depression, anxiety. There is some benefit to St. John's wort, but again, this is not. You have to watch out if you take this with other medicines like Zoloft or Paxil or stuff like that. So anything that's serotonin reuptake inhibitor and SSRI, don't take it. Take this with that. Don't take St. John's wort with this, with an SSRI. If you want, you can try the St. John's wort as a pick-me-up, but it's not really. It may help. Like I said, it may. Ginseng usually helps with fatigue and diabetes and just energy in general. If you want, you can try ginseng just as a tea. Not going to hurt you. But if you're experiencing fatigue or diabetes, you need to be actively medically evaluated. Don't take just ginseng thinking, hey, everything's great. If you're feeling tired after a long day, sure, drink some ginseng tea. That's going to hurt. Nothing's going to hurt you there. Black cohosh is supposed to help with hot flashes and menopause, vaginal dryness, and mood swings. Yeah, again, I've never seen any OBGYN think, oh, take some black cohosh. And no. You can try it. Again, these are all you can try. And these are the reasons people use it, but don't use it as an active medical treatment. Green tea is supposed to help with increased HDL cholesterol and increase the good cholesterol and decrease the bad cholesterol. You can try it. Again, it's not going to hurt you, but don't use it as your only method of treatment. And valerian is supposed to help with insomnia and anxiety. You can try this, but watch out with other sleep medicines. So let's see if there's any other questions. I think that's the only questions thus far. Today was a sort of a shorter day. I tried to make it up. I started late only because I had a lot of patients that were calling in. I still have them calling in right now. I'm fairly late in answering some of their calls, and so it's been a busy day for me, so I'm sorry for the delay. But I'm still here. You can ask questions. Just try to, if I'm not there at 12:30, I might be there at 12:45, 12:50. I try my best to be here at this time, especially during the weekdays. If you have any other questions or concerns, just leave me. You can direct message me, or you can email me, or you can just look me up, or you can find me on Google. I have an office in San Jose, California, and my wife is there. Sometimes you might see her. Sometimes you might hear my daughter. But if you have any questions or concerns, please feel free to ask. Thank you again for being there, and I'll see you guys Monday. Bye.